So I was talking about my patient that drives a Hummer, and his memory was very poor, according to the tests that we did. And he was there with his cousin, and his cousin told us that he had asked about 4 times, why are we here? Why did we come for this appointment? Why are we here today? And, his cousin would tell him each time why they were there, but he couldn't retain that information. And we were both very alarmed because he's driving a huge tank. And he also admitted to me that he had bumped into a tree when he was moving his cars around. And he had damaged the bumper pretty bad. And we said, we said to his cousin, do you think that your cousin should be driving? He said, oh yeah, 100%, no doubt. And, we said, well, we're both doctors here and we're pretty concerned about this and we don't think he should be driving. And he said, I have no problem at all with his driving. He's like, I'll ride in the car with him. I rode in the car with him here today. And we asked him, well, would you consider letting your girlfriend drive? He said, well, I don't think that she can drive the Hummer. So, I'm just going to keep on driving. And so he said, okay, well, our advice is that you shouldn't drive. Since you feel like you can drive, what we'll do is we'll refer you to an occupational therapist who can evaluate your driving, and they will ride in the car with you and see how you drive. And, we're not sure how much that would cost for him to have this evaluation. Our understanding is it's a couple $100. He does have Medicare, which will pay a portion of it, but we don't know how much. And he basically said that he's not going to comply with the occupational therapy evaluation, that he has no use for it, and he's going to continue to drive. So that's where we left it with him. Even though there were 2 doctors in the room saying, we don't think you should drive, didn't faze him, it didn't faze his cousin whatsoever.
This would be a really good example of where the AMA guidelines could be helpful. So the American Medical Association decided that physicians had a responsibility to address this. And they came out with what was an ethical guideline. And they basically said that physicians have an ethical responsibility to report a patient under 3 circumstances. The first one is if there are laws about it that mandate reporting, then they need to follow the laws. But since very few states have such laws, they said under those circumstances, the physician has an ethical responsibility to report a patient if they are convinced that they are not safe drivers and they believe this person will continue to drive. So this example would be the exact scenario where the AMA would say the physician has an ethical duty to report them.